My name is Dr. Max Hickman and my role is to provide clinical advice to support Eastern AHSN's CVD program, specifically the adoption of the NICE lipid management pathway in primary care. Our aim is to help demystify lipid management and enable more people to achieve good management of their cholesterol. Cardiovascular disease affects around 7 million people and is responsible for 1 in 4 premature deaths in the UK. Our work will improve cardiovascular disease outcomes for patients in the region, reducing the incidence of CVD events such as heart attacks and stroke. Our programme needs to reach not only health professionals but also the wider public to partner together and improve cardiovascular health. To be successful, we should not be just focused on lipid-lowering therapies, but also on healthier lifestyles, and this will include also partnering with the neighbourhood teams being developed by the integrated care boards. We are adopting a population health management approach, which means we are using data to prioritise which patients would benefit most from lipid-lowering therapy and enable ways of working to treat these patients at scale in their communities. The aim is to reverse the ever-increasing gap in cardiovascular outcomes between prosperous and low-income communities. There is currently a gap between primary care and specialist care in lipid management. In addition, from a primary care perspective, familial hypercholesterolemia is sometimes seen as a niche clinical area with not enough people being diagnosed. This, I believe, is in part due to low awareness of the importance of this condition. We need to simplify the clinical pathway so that the latest NICE recommendations are more widely adopted. We are perhaps in a similar position to where we were a few years ago with direct oral anticoagulants in atrial fibrillation management. The unfamiliarity with the latest therapeutic interventions and lack of encouragement in their use from commissioners are significant barriers to uptake. This needs to be corrected if we're going to make the step changes needed in lipid management. We do need to encourage primary care to improve statin and other therapies uptake in relatively deprived populations. This could have a big effect on addressing health inequalities. However, we do also need to be mindful of the current pressures on primary care. We hope to engage with as many partners as possible across the region to support our population health management approach. This needs to be embedded in our local healthcare systems and neighbourhood teams, with recruitment in our partners in social care and the voluntary sector. It is key that we work together across health and social care to focus on prevention. Tackling Cholesterol Together is an education campaign hosted by Heart UK to support healthcare professionals to keep up to date with the appropriate management of patients with poorly optimised cholesterol. We need to encourage primary care colleagues to sign up to this and build it into their personal development plans.